1, 2, 3, action. Hello, Mrs. Savvy. How are you?
Yes. Fine.
Are you still coughing pretty hard?
Yes.
Okay, well we do have some results. So we just got the results back. Basically, the x-rays show that you have a pneumonia on your right lung. So we do have a pneumonia that we're dealing with. Your blood work also came back and it showed that your white blood cell count is a little elevated at 12. So there definitely is an infection. What I'd like to find out first is your vital signs from the nurse. Melinda, do you have the vital signs from this morning?
I do, Dr. Singh. Her temp's 99, blood pressure 105/60, respiration's 15, pulse is 88, and her O2 set's been running 90 to 91%.
Okay, I think she can benefit from some nasal cannula O2. What we need to do in order to treat this, Miss Savvy, you need to be on IV antibiotics for at least several days. And you will also need a nebulizer, which we need to do several times a day. Now, we usually do this in the hospital, so we can certainly admit you to the hospital if you like. We do have another option, however. If you prefer, we can treat you at the facility here using our acute care pneumonia pathway. And what that involves is we will start the IV antibiotics at the nursing home. We will also give you the nebulizer treatments. And Melinda or one of the other nurses will be checking your vital signs at least twice a day while you're there. And what I will do is I will talk to you in this manner at least once or twice a day to make sure you're making progress. That way we can keep very close tabs on you. If things get worse for any reason, we can always send you to the hospital at that point. But at least for now, we can keep very close tabs and make it a lot simpler and easier for you. And in fact, if your daughter Deb is around, I can even speak to her whenever she has any issues or concerns.
Yeah, Dr. Singh, I am right here.
Oh, Deb, do you want to move right into the view of the camera, please? Hi.
I would prefer for her to stay here to be treated. She does get a little confused when she gets out of her environment. So
Okay.
if that's possible, that would be great.
Yeah, I think we have a handle. I think we have a handle on the situation. Her vital signs are really not too bad, as long as we're on top of it and pay very close attention. I think we can get her through this illness. It'll be a lot easier for her, certainly. So if that's okay, why don't we go ahead and start the IV Levaquin? Okay? And what we'll do is
I think this is great that you're able to treat her like this.
we're really excited. I'm sure she'll do really well. I mean, we're at a great facility. They have great nurses. They can administer all the medications. We will also be checking your blood work on a daily basis. And we can get a chest x-ray every one or every other day. Okay? Any other concerns or questions? Why don't we listen to your lungs first, okay, Miss Savvy?
Very good.
So Melinda, if you can get the digital stethoscope, we can take a listen. Okay, take a nice deep breath. Okay, I hear that wheezing. You have a few crackles in that right lung. Okay, okay. All right. Okay, that sounds good. I got a good signal. Thank you. Okay. Okay, there are some crackles and wheezes, but your heart rate is regular. Okay, Miss Savvy, so we'll be seeing you shortly. Probably later on today, and certainly tomorrow morning, okay?
Thank you, Doctor.
If you have any questions and concerns, tell the nurse and we'll get a hold of you, okay?
Thank you.
Bye-bye.
Thank you.
Thank you.
Thank you, Dr. Singh.
Thanks, Deb.